Hello, hello. Hey, hey everybody. Welcome to NCLEX Jeopardy. If you are here and you can hear me, please put a yes, a thumbs up, whatever you want in the comment below. And welcome to NCLEX Jeopardy, the big, I won't say finale because we're going to do these once a month. But hey guys, happy Thursday. Let me get all my stuff. No, not that one. Hi. Okay. All right, guys. So how are you guys doing today? How was your Thursday going? If you don't know me, I hope you do because you signed up. But if you don't know much about me, my name is Nurse Sam. I am an LPN, been so for 8 years. I'm also CEO and founder of Nurse Sam Global Media, where I help nursing students just like you pass NCLEX, survive and thrive nursing school so they can go on to become amazing nurses. I've been doing so for about 2 years. I have sold thousands of study kits, probably about 10,000 at this point. And I've helped thousands of RNs and LPNs both pass their NCLEX PN, NCLEX RN, and go on to become amazing nurses. So I also help people come into nursing school with ATITs. But right now we are focused on that exit exam. We are focused on that NCLEX, okay? You guys know that NCLEX is that exam that you need to get your licensure in whatever state. Okay, so whatever state you're in, this is the test that's given by your specific state to make sure that you are competent enough to get licensed as a registered or licensed practical nurse in your state, so you can go ahead and practice. All right, so with that being said, little ground rules, let's do some housekeeping. So as you can see here, we have our NCLEX Jeopardy style board. Okay, we have our 5 categories. We have fundamentals, adult health / med surge, pediatrics, pharmacology, and conversions. We're going to specify that math. Okay. So how we're going to work, just like regular Jeopardy. We're not going to do teams. Everybody's their own team. So how we're going to play is that whenever I click a question, okay, however much it's going to be worth. So let's say I click fundamentals for 100. The question pops up. The reason why I chose to do it in a webinar form instead of Instagram so I can keep track of the comments, because since we're not playing on teams and everyone's their own team, how are we going to keep up with points? Because the people with the 3 highest scores are going to win some prizes. So how I'm going to keep up with the score is whoever answers first and pops up in the chat first for my chat. Okay, so I have my chat here, and that's what I'm going to be going, and it's done by time, so everyone's marked in by the second, literally. So whoever pops up on my screen first, it should be the same, but just in case, but whoever pops up on my screen first, saying what is, and then whatever the answer is. So you can say, and it's either 1, 2, 3, 4, A, B, C, D, whatever, but make sure you put what is before you say whatever answer. Okay, you don't have to type out the whole answer. You can just put A, B, whatever, but you have to put what is. Okay, so little tip, if you go ahead and type in what is and then just copy it, so that way when you get ready you can just paste it and then just press your number. That's the little tip. Okay, we've been playing this for a long time. If you don't get some questions right in the beginning, no worries. Okay, because let me tell you, I think almost every game somebody comes in last couple questions, those 500s, and wins the game every time. Okay, so we are going to go ahead and get started. If y'all have any questions, please put them in the comments. If you don't, I'm going to go ahead and get started. Hopefully it's pretty simple, but we're just going to play this fun game, answer some NCLEX questions. So let's see. Somebody pick a category and an amount, and we will start. So whoever picks an amount in a category first, that's what we're going to start with. I hope you guys are ready. And I'm going to move my head. Hold on. You won't see when the question's like playing. Okay, so, all right, Jarita said peds for 200. So let's do it. Peds for 200. All right, so here is the question. All right, I'd like to give you guys a minute. Okay, so we're going to have 60 seconds on the clock. Y'all read it to yourselves. I'm not going to read it. I'm going to let y'all read it. And then after the minute, we're going to read it together. Okay, so y'all have a minute to go ahead and answer. Good luck. Putting my timer on. Okay. All right, so remember you have to put what is and then the answer. So if it's select all to apply, make sure you put what is and then whatever it is. And remember with select all that apply, right here we have 6 answer choices. So it can be as little as one of the answer choices that's correct or as many as all 6. All right, that's the gift and the curse of select all that apply. All right. All right, so we have our first answer. All right. All right, we have some people answering. Great job. Okay, so let's go ahead and read it. All right, so the school nurse prepares a list of home care instructions for the parents of school children who have been diagnosed with pediculosis capitis, or head lice, which should be included in the list. Select all that apply. All right, so choice 1 says siblings may also need treatment. 2 is use anti-lice sprays on all bedding. Oh, your time's up. 2 is use anti-lice sprays on all bedding and furniture. 3, use a pediculicide shampoo and repeat treatment in 14 days. 4, grooming items such as combs and brushes should not be shared. 5, launder all bedding and clothing in hot water and dry on high heat. And then 6 is vacuum floors, play areas, and furniture to remove any hairs that may carry live nits. All right, so let's see what our answer is. What is 1, 4, 5, and 6? 1, 4, 5, and 6. Let's see who got that. Who said 1, 4, 5, and 6 first? Jarita Perry. Good job, Jarita. All right, so Jarita was the first one to get it. So Jarita, you're on the scoreboard with 200 points. Awesome job. Let's see who else got 1, 4, 5, 6. Christelle, great job. I must have hit repeat. Christelle, great job. Lauren Johnson, awesome job. Great job. All right, so let's go ahead and go over it so we can see, because I see a lot of you guys chose 1, 4, 5, 6, but you chose 3 as well. So let's go ahead and see why it wasn't 3. So it says bedding and linen should be washed with hot water and dried in a hot setting. Thorough home cleaning is necessary to remove any remaining lice or nits. Siblings may need to be treated, and combs and brushes may need to be discarded or soaked in boiling water for 10 minutes. Anti-lice sprays are unnecessary. Additionally, they should never be used on bedding, furniture, or a child. Okay, so that's why number 2 was not right. 3 says, no, the pediculicide product needs to be used as prescribed, and the parents are instructed to follow package instructions for timing the application and for contraindications for their use in children. All right, so it says use a pediculicide shampoo and repeat treatment in 14 days. So repeating the treatment in 14 days is why that answer is wrong. You want to use it as prescribed. It may not need to be repeated. So that's why number 4 was not, no. Oh, sorry, number 3 wasn't the correct answer. So if you chose number 3, that's why. It's supposed to be used as prescribed. Okay. All right. So great job again, Jarita, and everyone else that got that. If you didn't get it, it's no worries. Okay. That's why we are here doing NCLEX Jeopardy. All right. So let's go ahead and do another one. All right, so I'm going to choose this one, and we're going to do fundamentals for 300. All right, fundamentals for 300, you have a minute on the clock. And go. Remember, read it in your own words. Reword the question if you need to, but make sure you're always asking yourself and thinking about what the question is actually asking, okay? All right, we got some people answering. All right, let's see. All right, a lot of us has answered. All right, so let's go ahead and read the question. A child with leukemia is experiencing nausea related to medication therapy. The nurse, concerned about the child's nutritional status, should offer which items during an episode of nausea? All right, is it 1, low-calorie foods, 2, cool, clear liquids, 3, low-protein foods, or 4, the child's favorite food? Let's see what that answer is. The answer is, what is 2, cool, clear liquids? All right, let's go ahead and see who got that first. Lauren Johnson, awesome job. All right, Lauren, you are on the scoreboard. Make sure Lauren Johnson with 300 points. Congratulations, you are now in the lead. All right, so Lauren has 300 points and Jarita is right behind her with 200. All right, there's plenty more questions left and plenty more time for you guys to come in and sneak those prizes, okay? All right, so let's go ahead and go over the rationale. Let me move my head, 1 second. Sure. When the child is nauseated, it is best to offer frequent intake of cool, clear liquids in small amounts because small portions are usually better tolerated. So true. Cool, clear fluids are also soothing and better tolerated when a child is nauseated. It is best not to offer favorite foods when the child is nauseated because foods eaten during times of nausea will be associated with being sick. So if you give them their like let's say they love chocolate and you know that they're having trouble keeping things down, they're going to then associate eating chocolate with like throwing up or being nauseated, and then that will not be their favorite food anymore, I promise. So it is best to offer small, frequent meals of high protein and high calorie content once the nausea has been controlled with medication or has subsided. All right, so let's go. Great job, guys. Let's see who a lot of you guys got what is 2. So Faith got it, Quado, Jay, Chanelia, Deja, Jessica, Christelle, Atonia, Jarita, Alexis, Jenilyn, Ashley, Anna Marie. Awesome job, guys. All right, so next question. And let's do Pete's for 100. All right, remember, what is? Answer the question, read it in your own words. This one's not select all apply, so just one answer choice. All right. All right, so when caring for a 3-year-old child, the nurse should provide which toy for the child? Is it 1, a puzzle, 2, a wagon, 3, a golf set, or 4, a miniature farm set? Don't we just love developmental milestones? Okay, let's see what our answer is. All right, it is what is 2, a wagon. Let's see who got what is 2. So who got what is 2 first? Wait for it. Is it Quado? Is it you? I think it's Quado. Wait, let me check the time. Yeah, I think it's you, Quado. All right, so awesome job, Quado. You are on the scoreboard with 100 points. You know what, actually. Going to. All right, so between questions, I'm going to type accepting answers now, so that way I can see the difference between starts and stops. So awesome job, Quad. You are on the scoreboard with 100 points. All right, so quick little recap of our scoreboard. We have Lauren Johnson in the lead with 300 points, then Jarita with 200, and then Quad with 100. All right, guys, so let's go ahead and go on to the next question. And let's do adult health for 400. Let's make it jazzy. All right, so accepting answers now. And good luck. Be right back. All right, what is our answer? All right, so the question reads, the nurse determines that a client with which history is at the nurse determines that a client with which history is most at risk for endometrial cancer. So 1, hysterectomy, 2, steroid replacement therapy, 3, estrogen replacement therapy, 4, occupational exposure to dust. All right, let's see what our answer is. Answer is, what is 3? Estrogen replacement therapy. All right, it says endometrial cancer is related to the hormone estrogen because estrogen is the primary stimulant of endometrial proliferation. All right. So let's see who got that. What is 3? Lauren Johnson got that again. Awesome, Lauren. So you got another 400 points added to your score. So you now have 700 points. Awesome job. Okay, so once again, that answer was 3, estrogen replacement therapy. And that is because estrogen is the primary stimulant of endometrial proliferation. Okay. And you guys know that cancer forms when with cell turnover, when there's a mutated gene. And when you have estrogen, with estrogen being the primary stimulant of endometrial proliferation, that cell turnover rate is rapid. So the chances of that mutated gene or for that gene to be mutated is increased, especially because if you're getting an estrogen replacement therapy, you're getting an extra dose of basically the accelerator of those of that endometrial proliferation. So that's going to boost up that risk of the endometrial cancer, if that makes sense. All right, so next question. Let's do farm. Farm for 5. Farm for 500. All right, guys, accepting answers now. You guys know what to do. This one's not select all that apply, so just one answer choice. All right, I'm seeing some answers. Let's go ahead and read it. Allopurinol has been prescribed for a client with chronic tophaceous gout. The nurse explains to the client that what condition can occur during the first few months of treatment. Ooh, that's a good one. All right, let's see what that answer is. What is 4? Acute gouty arthritis. All right, I said arthritis. All right, so the answer was what is 4? Let's see who got that. Jarita Perry. All right, guys. So Jarita, you got an extra 500 added to your score, which brings you to a score of 700, which means you and Lauren are tied for first with 700. And then we have Quad with 100 points. That's our scoreboard right now. We still have plenty of time and questions for you guys to get on the scoreboard and get to the top 3 spots, okay? All right, so this says allopurinol, okay, is an anti-gout medication. It decreases uric acid production by inhibiting the enzyme xanthine oxidase and reduces uric acid concentrations in serum and urine. During the initial months of treatment, allopurinol may increase the incidence of acute gouty arthritis. So the risk of an attack can be reduced by concurrent treatment with colchicine or an NSAID, non-steroidal anti-inflammatory drug, if their kidneys allow it. All right, so yes, the answer was 4, acute gouty arthritis. All right. Next question. Let's do some conversions. Let's do a conversion for 200. All right, so this one is not multiple choice or select all. Fill in the blank. Remember, round to the nearest whole number. All right, so you must put what is and then whatever the whole number is. Okay, you don't have to put the drops per minute because I know that's what we're looking for. So make sure you put what is and then whatever the number is. Go right ahead, guys. Looks like we're looking for the drops per minute. All right. All right, let's go ahead and read that question. The nurse is asked to regulate the flow of an intravenous solution being administered to a client. The IV bag contains 50 milliliters of solution, and the solution is to be administered over 30 minutes. The administration set has a drop factor of 10 drops per milliliter. The nurse should regulate the roller clamp on the infusion set to deliver how many drops per minute? Fill in the blank. Round to the nearest answer. All right, so let's see what our answer is. The answer is, what is 17 drops? What is 17 drops? If you're on Instagram Live, I am going live because we are doing NCLEX Jeopardy. If you're on live, that means you are not in the webinar room right now. You're missing out. All right, so we just went over a conversion question. The answer is, what is 17 drops? I'm about to see, and I didn't put accepting answers. I'm about to see what the correct answer, who got the first answer. And that is Lauren Johnson. Awesome job, Lauren. Who else got 17? Christelle, Jessica, Deja, Chanelia, Anna Marie, Alexis, Sydney. Great job. So great job to everybody that got 17. The correct answer was 17 drops per minute. All right, so let's go ahead and break this down. So I'm gonna read the question one more time. The nurse is asked to regulate the flow rate of an IV solution being administered to a client. The IV bag contains 50 milliliters of solution. So that's our volume. All right. Our volume is 50 milliliters. And it's to be administered over 30 minutes. All right. So we know our time is 30 minutes. All right. It says the administration set has a drop factor of 10 drops. So they usually give us our drop factor. In this case, it was 10 drops. All right, so that's usually what we need. Volume, drop factor, and time. And that's how we get drops per minute. All right, so with that being said, let's go ahead and use our equation for figuring out drops per minute, which is the total volume over the time in minutes times the drop factor. Okay, so that's always going to be our formula. So make sure you have that in your mind, what that formula is for how to calculate drops. If you don't know, if you need extra practice with dosage calculations, I do have a dosage calculations Monopoly themed study kit. You can get that individually. You can get that in the first semester study bundle or in the ultimate study bundle that has all the study kits. All right, so once again, we have our volume, which is 50 milliliters, over our time, and our time is measured in minutes. So we don't have to do any conversions. If it was measured in hours, we would have to convert that minutes to hours, but we don't have to do any conversions since it's minutes and minutes. So 50 milliliters, which is our volume, over 30 minutes, which is our time, times our drop factor, which they gave us, which is 10. Okay, and then we just multiply that and that's going to give us 16.66. But we know with drops, you can't have a fraction of a drop. So you're going to have to round to the nearest whole number. So we're going to use our rounding rules. And we know that if it's 5 or above, we're going to round up. In this case, it is 6. So we know we're going to round to that. We're going to round up. So 17 is our next highest number. And that's how our answer is 17 drops per minute. All right. So once again, that was Lauren who got that. So Lauren, I'm going to add 200 points to your score, which boosted you back up into first place. You now have 900 points. Jarita has 700 points, and Quad has 100 points. Still plenty of time for people to get on the scoreboard. So make sure you are answering. All right, so let me put accepting answers now. Let's go ahead and go on to the next question. All right. Let's do an adult health for 300. Let's do an adult health for 300. And I already put accepting answers now. So you guys know, put what is, because we are playing NCLEX Jeopardy. All right, this one is not select all that apply, so just one answer only. If you guys are on my live, go to the link in my bio. No, I don't know if you guys can go. I don't know if you guys can register. I'm not sure. So let me get off live and put the backroom link if you guys want to join. Okay, so I'm gonna get off live and go into my stories. Bye. All right, so let's go and read the question. The nurse has reinforced instructions to the client with the cystocele about Kegel exercises. The nurse determines that the client has not fully understood the directions if the client makes which statement? 1, stop and start the stream of urine several times during avoiding. 2, tighten perineal muscles for up to 10 seconds several times a day. 3, tighten perineal muscles for up to 5 minutes 3 or 4 times a day. Or 4, begin voiding and then stop the stream, holding residual urine for an hour. Let's see what that answer is. What is 4? The correct answer is what is 4. So let's see who got that one. Iris. Iris is new to the board. Hey, Iris. Welcome to the scoreboard. You are now on the scoreboard with 300 points. So once again, we have Lauren with 900, Jarita with 700, Iris with 300, and then Quad with 100. Awesome job. Great job, guys. So tell the truth. When you read this and you were going through the answer choices, did y'all do Kegels? Don't lie. Do not lie. I know y'all did maybe 1 or 2. Don't lie. Okay, so it says Kegel exercises strengthen the perineal floor and are useful to prevent and manage cystocele, rectocele, and enterocele. There are several acceptable ways to perform Kegel exercises. I know you're about to do it right now. These involve starting and stopping the flow of urine either once for up to 5 minutes or several times during a single voiding for about 5 seconds. Because the muscles that control urination are also involved in defecation or pooping, these exercises are also can be done. These exercises also can be used during defecation. Otherwise, they may be done by holding the perineal muscles taut for up to 10 seconds several times a day, or for 5 minutes 3 or 4 times a day. Are you doing it? Do it. Go ahead and do it. All right, so option 1 is not a correct method for performing Kegel exercises. Residual urine should not be held in the bladder for lengthy periods of times because it could promote urinary tract infections. You know, stand in water, whether it's urine or whatever, it's never good, okay? So residual urine can lead to UTIs. She said whenever I answer these questions, whenever there's like a Kegel question or any type of question where it's like especially like physical assessment questions, I'm like, okay, if here. So on the NCLEX, I was feeling myself up. They probably were gonna like kick me out for indecent exposure or something. I don't know, but I have to I'm a visual learner and I'm a kinesthetic learner, so I have to manually do something. Even here, I had to okay, let me make sure I know how to do a Kegel. All right, so next question. Let's do farm for 4. All right, pharmacology for 4. This is a good one. Oh, man. Okay, I know it's after Drita. All right, so a healthcare provider tells the nurse that a potassium-retaining diuretic is being prescribed for the client with heart failure. The nurse reviews the healthcare provider's prescriptions, expecting that which medication will be prescribed. Is it 1, furosemide, 2, ethacrynic acid, 3, spironolactone, or 4, hydrochlorothiazide? Let's see what our answer is. It is, what is 3, spironolactone? Let's see who got that first. Lauren Johnson, back at it again. All right, Lauren, you have another 400 added, which means you are now in the 1,000 points club. You would now have 1,300 points, okay? So 1,300, Drita with 700, Iris with 300, and Quad with 100. All right, so let's go and see why it is number 3. So it's asking us for a medication that is a potassium-retaining diuretic being prescribed for a client with heart failure. So spironolactone is a potassium-retaining diuretic that promotes sodium excretion while conserving the potassium. All right, so we know that one of the big issues with diuretics, I wouldn't say issues, but one of the main, I guess you can say side effects of diuretics is that the potassium is also depleted because, you know, with diuretics, you're diuresing the fluid. So you're dumping out that fluid. And while you're dumping that fluid, you're also dumping out that potassium. So a lot of times when clients are in heart failure or they have congestive heart failure or something where they need a diuretic to rid themselves of fluid. So congestive heart failure would be the perfect example. You guys know that with potassium, it is dangerous if it's too high and it's dangerous if it's too low. So potassium is something that we need to be as normal as possible because it affects contraction and it affects the muscles. And one of the biggest muscles, the most important muscles, is obviously the heart. So imbalances with potassium can cause lethal dysrhythmias. So you want to make sure that that potassium is still within normal limits and not being touched by the diuresing fluid. So that's why, especially with clients with heart failure or heart issues, cardiac issues, you want to make sure that they're getting a potassium retaining diuretic so they're not losing the potassium as the fluid is being lost also. All right, so an example of that, once again, is spironolactone. Great job. Let's go on to our next question. All right, let's do peds for 3. Checking answers now. All right. A 9-year-old child is diagnosed with chlamydial conjunctivitis. The nurse consults with the registered nurse and pediatrician regarding necessary follow-up because this infection can be associated with which finding? Is it 1, possible sexual abuse, 2, the presence of otitis media, 3, the presence of systemic allergies, or 4, the cleanliness of the home environment? What is that answer? The answer is 1, possible sexual abuse. All right, so a diagnosis of chlamydial conjunctivitis in a child who is not sexually active should signal the pediatrician to assess the child for possible sexual abuse. Algae and infection can cause conjunctivitis, yes, but remember the infecting organism is chlamydia. So that's only contracted sexually, all right? That's a sexually transmitted organism. So if a child has a sexually transmitted organism in their eye that's causing that eye inflammation, that's gonna prompt that pediatrician to assess for further signs of possible sexual abuse. All right, so it was that chlamydial conjunctivitis. It was conjunctivitis is something that can be caused by allergies, all that stuff, because it's just the inflammation of the eye. But that chlamydial is saying what that organism is, and it's important to know that that chlamydial organism is only acquired sexually. All right, so although the infection can be transmitted, it is not directly associated with cleanliness in the home. It may be suspected in a sexually active adolescent with chronic infection that is unresponsive to other treatment. All right, so let's see who got what is one first. Lauren Johnson with 300 more points. All right, Lauren, you are at 1,600, love. All right, guys. Next question. Still plenty time and points to go ahead and get on the scoreboard and get into the first 3 spots. Okay. Let's do fundamentals for 500 and accepting answers now. All right, so the nurse inspects a pressure injury on a client's sacrum and notes that the site has partial thickness, skin loss, and the formation of a blister. The nurse should document the pressure injury as which category? Stage 1, stage 2, stage 3, stage 4, or stage 5? Wait, take out the stage 4. I'm at 5. It's just stage 4. All right, so let's see what that correct answer is. Correct answer is what is 2 or stage 2. Let's see who got that one first. Ooh. Somebody messaged me privately the correct answer, but you didn't put what is. So to Thuong, make sure you put what is, because this is NCLEX Jeopardy. Otherwise, you would have got it. But you didn't put what is. So that means the next person that got it is my girl, Alexis. Hey, Alexis. Hey. Alexis is now on the scoreboard with 500 points. Awesome job, Alexis. All right, so going over the scoreboard, we have Lauren Johnson with 1,600, Jarita with 700. Alexis just came out of nowhere with 500. And then Iris with 300 and Quado with 100. Okay, I'm telling y'all, it could be anybody's game now. Be anybody's game. All right, so it says a stage 2 pressure injury is characterized by non-intact skin. There's a partial thickness skin loss, and the wound may appear as an abrasion, a shallow crater, or a blister. I love that word. I'm kidding. I hate that word, blister. A stage 1 pressure injury is a reddened area that doesn't blanch. Okay, that doesn't blanch, but it has intact skin. Make sure y'all write that down, because a lot of times when like the NCLEX or even in nursing school, when they're talking about characterizing and staging those wounds, they talk about whether or not it blanches, it has intact skin. That word blister comes up. So make sure you're writing down the difference between stage 1, 2, 3, and 4, and what actually differentiates them. Like I said, intact skin. Is it the fact that it doesn't blanch? Is it the fact that it's muscle exposed? So that's how I would go through stage 1, 2, 3, and 4, just so it can be a little bit more easier to identify. But you guys can do fine with this. All right, so stage 3 and 4 pressure injuries are full thickness or full thickness with necrosis or damage to the muscle, bone, or supportive tissue, respectively. Okay, so obviously stage 1 is the least severe, and stage 4 is the most severe. Usually with clients with pressure injuries. They're having tunneling. Iris said tunneling. Yes, good one. They're usually on like high protein diets. They have like zinc, anything to help with wound healing. I said protein already. If they don't have like usually they'll have a high protein diet, but in addition to, especially if they have like that stage 3, stage 4, getting to the more severe staging, they're going to have to up that protein and all those other protein, zinc, like they're going to check those albumin levels just to make sure that the wound healing ability isn't impaired and is optimal, because stage 3 and 4 are very hard to, close, especially even with wound care. So, and you guys know with pressure injuries, because of that exposure, the client is at an even more increased risk for infection. So, all right, next one. Let's do another conversions. Let's do conversions for 100. Oh, this is a good one. This is a good one. All right, so we are converting. Does anybody else feel like I can convert some drops and, like IV flow rates with the best of them? But when it comes to like the basic stuff, like, okay, how many ounces of this? I'm like, I don't know. I don't know. So this is, for me, something that I had to really work on, because even though it was basic, sometimes the most basic things are forgotten just because we're like, oh, it's basic, it's easy. But no, I had to make sure I knew how many ounces was in a cup. Ooh. All right, so I am seeing answers already. All right, so the nurse is calculating a client's 24-hour fluid intake. The client consumed coffee, 8 ounces, water, 8 ounces, and orange juice, 6 ounces for breakfast. For lunch, the client had soup, 4 ounces of soup, and 8 ounces of iced tea. And then for dinner, 10 ounces of milk, 8 ounces of tea, and 8 ounces of water. Okay, maybe a liquid diet, probably, yeah. The client also consumed 24 ounces of water during the day. How many milliliters of fluid did the client consume in the 24-hour period? Let's look and see. What is 2520 milliliters? Good job, guys. All right, so 2520. First person to get that was Christelle. Hey, Christelle, you are now on the scoreboard with 100 points. Congratulations. You and Quad are tied. All right, so let's figure out how we got to 2520. So we're trying to figure out how many milliliters of fluid did the client consume in that 24-hour period. So it looks like the client consumed a total of 84 ounces of fluid. We're going to add the 8 and 8 is 16. And then, okay, we're going to add all those together. It's going to be 84 ounces of fluid in that 24-hour period. Okay. Now, they're not asking for how many ounces of fluid. They're asking for how many milliliters of fluid that the client consumed. So since we have our ounces, we're just going to go ahead and convert from ounces to milliliters. So, and obviously in order for you to do that, you need to know the conversion. All right. We know that 1 ounce equals 30 milliliters. All right. So with that being said, if we know that 1 ounce equals 30 milliliters and we have 84 ounces, we're going to multiply that 84 by that 30, and that's going to give us that 2520. Jarita said, y'all are fast math people, right? Right. I'm still on 8 ounces. I'm still on lunch. I'm still on tea from lunch. All right. So, great job. Let's go to our next one. Let's do adult health for 200. And accepting answers now. Y'all are doing amazing. How are y'all feeling right now? Because you may or may not be getting, the first answer. You may not be getting it, the fastest, but you're getting the correct answer. Remember, we're just playing NCLEX Jeopardy for fun. This is just because studying for the NCLEX is boring. But for the NCLEX, you're not playing for who finishes first. You're playing for who passes. And you guys are getting the correct answers, and that is what is important. So you guys should feel amazing. Pat yourselves on the back and give yourselves a round of applause because y'all are killing it. Okay. All right. Now let's go ahead and break this one down. Ooh, what's for? It says the nurse should plan which to encourage autonomy in a client who is a resident in a long-term care facility. So 1, choosing meals. 2, decorating the room. 3, scheduling haircut appointments. Or 4, allowing the client to choose social activities. And that correct answer was number 4, allowing the client to choose those social activities. That's going to encourage autonomy in the client. Let's see who got what is 4 first. Lauren Johnson. All right, Lauren, you have another 200 points. And that just brought you to 1,800. Quick little overview. We got Lauren with 1,800, Jarita with 700, Alexis with 500, Iris with 300, and then Quad and Christelle with 100. All right, so autonomy. That's the personal freedom to direct one's own life as long as it does not impinge on the rights of others. You know who does not have autonomy right now? Britney Spears. If you want to think about somebody who does not have autonomy, it is Britney Spears. She does not have personal freedom to do just about anything. An autonomous person is capable of rational thought. This individual can identify problems, search for alternatives, and choose solutions that allow for continued personal freedom as long as the rights and property of others are not harmed. All right, the loss of autonomy and therefore independence is a very real fear among older clients. Also, okay, yeah, let me say that. Yeah, the loss of autonomy, which is also, you know, their sense of independence, is a very real fear among older clients. Especially if they're in a long-term care facility, they're going to think that they associate that with them, you know, feeling like they're in like a daycare and they can't do for themselves. So encouraging autonomy, especially in the older population, is really important. All right. Yeah, that's the only choice that allows for the client to be the decision maker. So that's really what you want to look for when you're encouraging autonomy. You want to have them be as active and participate in the client's care as possible. So an example of an activity where you can encourage autonomy would be when you are getting the client dressed for the day. Have 2 shirts out. Be like, hey, which one do you want to wear? You want to wear the red one or the blue one? Keep the option short, you know, but still giving them that choice instead of just being like, hey, this is what we're going to wear today. I'm going to dress you because you're my baby doll and you don't have a choice. Instead of doing that, you can be like, hey, we're going to get dressed today. I love your clothes. These 2 shirts are so cute. Mr. Charles from down the hall is going to look twice. So which one are we doing? We're doing the red one and the blue one. That's going to encourage that autonomy. All right. Now let's do fundamentals for 4. Ooh, this one has a figure. Okay. And on the NCLEX, you will have question types that are not just multiple choice. That's not just select all and apply. You'll have like drag and drop. You'll have fill in the blank like we just did. And you'll have some where you have to refer to the figure. Let me move my head. Okay. All right. So this question reads, the nurse is caring for a client following a craniotomy in which a large tumor was removed from the left side. Yeah, just the left side. In which position can the nurse safely place the client? Refer to the figure. All right, so we have our figure and we have 4, looks like we have a hospital bed in 4 different positions. A looks like semi-Fowlers. C is just straight down prone. B looks like Trendelenburg. and I don't know what D is. So let's figure it out. All right, so the correct answer is A. All right, A, which was, I guess that was that like semi-foulers or something? Let's go here. And let's see who got A or 1. Let's see. All right, and the winner. Wait for it. What? Wait for it. Christelle. It was Christelle. All right, Christelle. So you just got another 400 points added on to your score, which just brought you up to 500 points. All right. So right now our top 3. Wait, so yeah. Okay, so Christelle, you are now tied with Alexis with 500. So we have Lauren with 1,800. We have Jarita with 700. Alexis, Christelle are now tied with 500. Iris has 300 and Quad still has 100. All right, so these are all our people that has been on our scoreboard. All right, so there's still time, still plenty of time and points to get on the scoreboard and then get into the top 3 spots. Okay, so let's go ahead and read our rationale. I'm gonna move my head one more again. Okay, so this is clients who have undergone craniotomy should have the head of the bed elevated 30 degrees to promote venous drainage from the head. The client is positioned to avoid extreme hip or neck flexion, and the head is maintained in a midline neutral position. If a large tumor has been removed, the client should be placed on the non-operative side to prevent displacement of the cranial contents. A flat position or Trendelenburg position would increase intracranial pressure, which is not what you want to do. So one of the main things, like whenever you have a patient that has, and that is post-op and they just had like a brain surgery, craniotomy, anything like that, what you want to, one of the main nursing considerations is to avoid that increase in intracranial pressure. So a lot of your interventions are going to be behind avoiding that increase in intracranial pressure, and you can do that by avoiding bending, avoid lying flat or in Trendelenburg, anything that causes a bunch of pressure to go to your head. So that's what would cause increased intracranial pressure, which is not what we want in a patient that just had surgery on their brain. Okay. And then it says a reverse Trendelenburg's position would not be helpful, and it also may be uncomfortable for the client. Okay, so A was the correct answer. Okay, so all right, perfect. All right, let's do another conversion, and let's do this one for 4. I can read. All right, so this one is another fill in the blank. You don't have to put milliliters because I know that's what we're looking for, but you do have to put what is. All right, so the primary healthcare provider has prescribed phenobarbital sodium 25 milligrams orally twice daily for a child with febrile seizures. The medication label reads as follows: phenobarbital sodium 20 milligrams per 5 milliliters. The nurse has determined that the dose prescribed is a safe dose for the child. How many milliliters per dose should the nurse administer to the child? Fill in the blank. All right. So this is a classic case of like the amount you have on hand versus the amount that's ordered. It's going to give you your correct dose. So let's go ahead and see what that answer is. All right. The correct answer is, what is 6.25? 6.25 milliliters. Who got that one? I'm trying to see. Yeah, it would be 6.25 because they didn't specifically say to round. Because I saw a lot of you guys round at 6.3, but remember with medications, especially oral medications that's given via liquid, you can measure. It doesn't have to be a whole number. You can measure it, up to the hundredths place. So 0.25, that's something that can actually be measured. You wouldn't have to actually round it, especially with dosage medication based or weight based medication. This one's not weight based, but dosage based, safe dosage based medications. Like this one's has to be a safe dosage for this child. So you don't want to round. Yeah, it didn't tell us to round. You don't round unless they tell you to round, but you want to round on things that can't be like fractioned, like drops. You're always going to round to the whole number for drops because you can't have a half a drop, but you can have half a milliliter. You can have a quarter of a milliliter. Okay, so I just wanted to just get that under the way. So with that being said, Lauren Johnson, all right, back at it again. 400 points added to your score. You have broken the 2,000 club, so you now have 2,200 points. Great job. All right, so let's go ahead and break it down. So it's asking us for how many milliliters per dose we should give to this child. So it's giving us the desired, how much the medication was prescribed, or how much of the medication was prescribed by the doctor. It was 20, or the healthcare provider, 25 milligrams. All right, so we have 25 milligrams. That's our desired dose. And then our volume is 5 milliliters, because right here, what we have available, 20 milligrams per 5 milliliters. So our volume is going to be our 5 milliliters. And then our, where am I? Available is going to be 20. There we go. So we are going to I'm sorry, hold on one second. There we go. Okay, yeah, so we're going to multiply. That says 25, but it's supposed to be 20. It's going to be the desired, which is 25, over the available, which is 20, times the volume, which is 5, and that's going to give us 6.25. All right. Farm, 300. Let's do it. Okay. Accepting answers now. Farm for 300. All right, I see it's answering. Great. So the nurse is monitoring a client who's receiving a dose of an adrenergic bronchodilator. The nurse plans to monitor for which side effect of this medication. Is it 1, drowsiness, 2, hypokalemia, 3, hyperglycemia, or 4, increased pulse and blood pressure? Let's see what that answer is. Answer is 4, increased pulse and blood pressure. It says side effects of an adrenergic bronchodilator can include tachycardia, hypertension, chest pain, dysrhythmias, nervousness, restlessness, headache, among others. All right, so the nurse monitors for these effects during therapy. And then options 1, 2, 3 are not side effects. So let's see who got 1 is 4 first. Shayla. Hey, Shayla. Shayla is now on the scoreboard with 300 points. Great job. All right, guys. So quick little study tip. Whenever, especially on pharmacology, because I know a lot of us struggle with pharmacology because there's just so many drugs. It's literally impossible to remember all of them. But remembering the class of the medication can help you a great deal. So As far as this one, we know that the type of medication we have is an adrenergic bronchodilator. Okay, and we know that an example of an adrenergic bronchodilator is, can anybody give me an example? Can anybody give me an example before I say it? Just type it in really quick, and I'll give you 100 points. Give me an example of an adrenergic bronchodilator. First person to give me an example gets 100 points. What is an example of an adrenergic bronchodilator? Let me go back. Albuterol, correct. Yes, that is honestly that's the main / only one that I think of when I think of adrenergic bronchodilator. So yes, with albuterol, one of the main nursing teachings and considerations that they have, especially for the patients, is that they let them know, okay, when you have this albuterol, you may experience tachycardia, or how I used to describe it was you may be shaky, jittery, and I think what I say? Shaky, jittery, sweaty. Salmeterol and theophylline. Yeah, those are good ones as well. But yes, the tachycardia, hypertension, chest pain, dysrhythmia, nervousness. It to me it has this. I think of the same effects of kind of like steroids. Well, you know how they make you like shaky and like nervous. That's what I think about. No, I'm not thinking about. I'm thinking about albuterol. Yeah, your asthma pump. It's your tachycardia, you're shaky. I don't know if you guys. I have asthma, so I know, especially with me after having albuterol, that shakiness and that nervousness and that restlessness is definitely a super side effect. So I know from personal experience that side effect is one of the main ones. So I kind of like link that together when I'm thinking about adrenergic bronchodilators. You can do the same, but just think about the fact that it increases increases your heart rate, and it also increases your blood pressure, like it says. So next question. All right, where are we going? Let's do peds for 5. All right, so who was that said albuterol? Atonia was the first person that said the albuterol. So Atonia, you get 100 points, love. Yeah. 100 points. Awesome job. All right, guys. Go ahead and answer this question. It's just one answer choice. It's not select all that apply. Make sure you're choosing and using what is. All right, so the nurse is assigned to care for a child who is in skeletal traction. The nurse needs to avoid which action when caring for the child? 1, keeping the weights hanging freely. 2, ensuring that the ropes are in the pulleys. 3, placing the bed linens on the traction ropes. And 4, ensuring that the weights are out of the child's reach. Correct answer is what is 3, placing the bed linens on the traction ropes. That is, wait, hold on, let me move my head. That is what the nurse needs to avoid. Let's see who said what is 3 first. And it was Lauren Johnson. All right, Lauren, 500 points added to your score, bringing you to 2,700. All right, little overview of our scoreboard. We got Lauren in the lead with 2,700. And then we have Jarita with 700. Then we have Christelle and Alexis with 500. We have Iris and Shayla with 300. And Quado and Atonia. Am I saying your name right? Atonia. I'm going to call you A. With 100. Okay. So, great job, guys. Now, going back to this. As far as what that correct answer is. Now, this says the nurse needs to avoid which action when caring for the child. So you already know that when because the question is saying we're looking for what to avoid, we're looking for a negative answer. So we're not looking for correct answers. We're looking for the wrong one. All right. So in that case, 3 was placing the bed linens on the traction ropes. Bed linens should not be placed on the traction ropes because of the risk of disrupting the traction apparatus. Okay. Options 1, 2, and 4 are appropriate measures. Those are things that you want to do when caring for a child in traction. Okay. So great job. Sue fundamentals. Ooh, select all that apply. I was waiting for the devil. So they call select that apply Satan questions because it's only one letter off from Satan. So accepting answers now. Remember, select all that apply. Right here, we have 6 answer choices. So we can have as little as 1 correct or as many as all 6 correct. The gift and curse. Okay, so a client enters the emergency department confused, twitching, and having seizures. Upon assessment, flushed skin, dry mucous membranes, and an elevated temperature and poor skin turgor is noted. The serum sodium level is 172 milliequivalents per liter. Which interventions should the primary healthcare provider likely prescribe? Select all that apply. All right, is it 1, monitor vital signs, monitor intake and output, increase water intake orally, monitor electrolyte levels, provide a sodium reduced diet, or administer sodium replacements? Okay, so let's look and see what that answer is. 1, 2, 3, 4, 5. So pretty much all but 6. All but 6. Who got that? Deja. I see you, Deja. Great job. It looks like Deja's the only one to get that so far. Deja. Hello, hello. You are now on the scoreboard with 200 points. So proud of you. You're the only one that got that one. That one was a really good one to go through. So let's go ahead and break that down so we can understand why the answers were the ones that they were. Let me move from my cranium. Okay, so let me go back to it. Now, let's go ahead and go back to the question. It says a client enters the emergency department confused, twitching, and having seizures. Upon assessment, we notice flushed skin, dry mucous membranes, an elevated temperature, and poor skin is noted. So right there, after noted, you should be thinking like dehydration, okay? That dry mucous membranes, elevated temperature, all those are signs and symptoms of dehydration. They just haven't said it yet. But because you're a nurse and you have critical thinking and you know your signs and symptoms, you know that these are all manifestations of, we can't say dehydration because that's an actual diagnosis. These are all signs and symptoms of fluid volume deficit. Okay. The serum sodium level is 172 milliequivalents per liter. All right. So boom, right from there. That sodium level being 172, we got to know what the normal range of sodium level is so we can evaluate whether that's good, bad, or ugly. So normal sodium, can anybody tell me what normal sodium is? They just said, "Woo, finally." What is the normal range for sodium? Type it in the comments. I don't care if you know it. Type it anyway. I'm going to type it too so we can all do it together. Let's all do it together. Yay. 135 to 145, correct. Burn that into your brain. Burn it into your brain. Okay, normal sodium level is 135 to 145. That's going to be the same whether you're an RN, LPN, Powerpuff Girl, Ninja Turtle, chef, it doesn't matter. Sodium, 135 to 145. Okay, great. So that sodium level being 172, that is obviously higher than our normal range that we just so graciously put it in our comments. So that 172 means that patient is hypernatremic. All right, they have a sodium level that is higher than the normal range. So what interventions for hypernatremia are we going to, would the primary healthcare provider prescribe? And with that being said, 1, 2, 3, 4, 5. So all of them except administer sodium replacements. And you wouldn't administer sodium replacements because they are not sodium deficient. Remember, they have a high amount of sodium. So you don't want to administer more sodium. It's just going to make them more salty. You see what I did there? So, 1, monitor vital signs. Let's just go back to the description. It says hypernatremia is described as having a serum sodium level that exceeds 145 milliequivalents per liter. Signs and symptoms would include dry mucous membranes, loss of skin turgor, thirst, flushed skin, elevated temperature, oliguria, which means scant urine. That oli is the prefix for like a small amount. And then urea means urine. Muscle twitching, fatigue, confusion, seizures. Interventions include monitoring the fluid balance because we know water follows salt. So if they have a high amount of salt, if they're hypernatremic, they're going to be dehydrated because that salt is going to pull the water from out the cell. Because remember, salt follows the water. And if we have salt going around freely in the blood, then the water content from the cells, which is where it's going to be needed, is going to be pulled from the cells and go into the blood. Wait. Hold on. Yeah, and so we know that pulling of that fluid is going to suck it dry, which is why you have those dry mucous membranes, that loss of skin turgor. So that, the test where you say to like pinch the back of your hand, and if it stays tented, you're dehydrated. That's poor skin turgor. Did you see mine? It tented. I need some fluids. Ooh, bad. All right, so once again, you want to monitor those vital signs. You want to monitor those electrolyte levels. Obviously, for the sodium, you want to make sure, hey, is it still high? Is it going back low? Is it normal now? So you want to monitor both the vital signs, the fluid balance, you want to reduce dietary intake of sodium, like I said, because it's already high. And you want to increase the oral intake of water. Why? Because they're dehydrated. Water follows salt. So they want to increase their oil intake to kind of dilute all that salt and help rehydrate their body. All right. Let's do adult health for 100. So they say not Powerpuff Girl. Yes, Powerpuff Girl. This is a long one, woo, but it's not select all that apply, so that's good. So I'm gonna give you all your minute. All right. And Deja, you got 200 points, love. All right, let's go ahead and read this question. While collecting data related to the cardiac system on a client, the nurse hears a murmur. Which best describes the sound of a murmur? Hold on. Did I mess it up? Oh, yep. I was like, did I put the answer in the... I was like, this looks abnormally long. I put the answer in the... I didn't put what is 3. The answer is what is 3, but I put the explanation in the question. So let's look and see who got what is 3. Got what is 3 first, and it was Lauren Johnson. All right, Lauren, you got another 100 points, bringing you to 2,800. All right, so as you guys probably read in the question, a heart murmur is an abnormal heart sound and described as a gentle blowing swooshing sound. It occurs from increased or abnormal blood flow through the valves of the heart. Lub-dub sounds are normal and represent the S1, which is the first heart sound. So let that S1 be for sound one, first sound, and S2, the second sound, respectively. So a pericardial friction rub is described as a scratchy, leathery heart sound that occurs with pericarditis. A click is described as an abrupt, high-pitched snapping sound. So one lub-dub sounds, those are normal. That's the S1 and S2. The scratchy, leathery heart noise, that's pericardial friction rub. So all these are descriptions of what diagnoses these are. So you have pericardial friction rub, you have the lub-dub sounds are normal, the gentle blowing or swooshing noise that describes it's on the tip of my tongue, heart murmur, and then the abrupt high-pitched snapping noise is a click. Okay. So we know lub-dub's normal, and we know the heart murmur is the swoosh. So that's why it is 3, gentle blowing or swooshing noise. Oh yeah, that was Lauren. Okay, great. Let's go ahead and finish fundamentals. Make sure I put the answer in this one. All right. Accepting answers now. Sada said they can have a question that long. I know that question that long, a minute, geez. All right. All right, so the nurse is caring for a client with kidney failure. No, the nurse who is caring for a client with kidney failure notes that the client is dyspneic and crackles are heard when listening to breath sounds in the lungs. Which additional sign or symptom should the nurse expect to note in this client? 1, rapid weight loss. 2, flat hand and neck veins. 3, a weak and thready pulse. And 4, an increase in blood pressure. All right, let's see what this is. 4, an increase in blood pressure. Who got that? Lauren Johnson. All right, Lolo. I'm sorry. I love like nicknames. I'm so sorry that was disrespectful. 2,900 for Lauren. Then we have Jarita for 700. We have Alexis and Christelle with 500. We have Iris and Shayla with 300. We have Deja with 200. And then we have Atonia and I hope so. We have A and Iris with A and Quad with 100. There we go. All right. So back to this question. All right. So going back to the question, it says we're caring for a client with kidney failure, and we note that, notice that I'm saying we, okay, because I'm speaking into existence that we gonna pass this NCLEX and we gonna get our license and become nurses. So when we are caring for a client with kidney failure, we noted that the client was dyspneic, which means difficulty breathing, and crackles are heard when listening to breath sounds in lungs. And you guys know that whenever there's a crack, snapple, pop in those lungs, it's not Rice Krispie treats. It is most likely flu. And that's bad. So which additional signs / symptoms should the nurse expect to note in this client? So we have a client with kidney failure that is having both trouble and difficulty breathing, and you can hear abnormal lung sounds, aka crackles, which signify fluid in the lungs. So in addition, so if you have somebody with fluid in the lungs, what else would you expect them to have? All right, so fluid in the lungs, I can't breathe. If someone can't breathe, what other signs would you expect to, see? And the answer was increase in blood pressure. So it says impaired cardiac or kidney function can result in fluid volume excess. Once again, those crackles let you know there was fluid where it should not be. So let's the fluid volume excess. Findings associated with fluid volume excess include cough, dyspnea, crackles, tachypnea, tachycardia, an elevated blood pressure, a bounding pulse, an elevated central venous pressure, weight gain, edema, neck and vein distension. Okay, note that because number 2 said flat hand and neck veins. All right, and if you have a bounding amount of fluid, or if you have an overwhelming amount of fluid in something, the veins wouldn't be flat. Okay, they would be popping out because there's so much fluid volume. So you would have distended neck and hand veins, not flat ones. Flat would be if you were dehydrated. You would also have an altered level of consciousness and a decreased hematocrit level. Okay. Does anybody know why that hematocrit level is going to be decreased? Can anybody tell me why that hematocrit level is going to be decreased? For 200 points, tell me why. Okay. So while y'all telling me why, the rest of those signs and symptoms, like we said, had to do with that fluid volume excess being noted. And we know that if we have extra fluid where it's not supposed to be, not only do we have extra fluid where it's not supposed to be, it's actually in our lungs. So that's going to affect our oxygenation. Correct, Sade, the dilution of the red blood cells. When you have fluid volume excess, you have to think about you have a whole bunch of water, so you're diluting that, you're diluting those red blood cells. And if you have a diluted amount of red blood cells, it's not going to be as concentrated. So if it's not concentrated, that hematocrit is going to be decreased. Okay, because remember, the hematocrit is that concentration of red blood cells. And if you have, just think about when you're like, if you have some sweet tea that's too sweet and you add some water to it, it's going to dilute it. And there's going to be, more water to dilute like the sugar particles to make it less concentrated and less sweet. Hypochromic. Woo. So awesome job, Sade. So Sade on the scoreboard with 200 points for that one. Great job. That was an important thing to know because once again, the whole thing with NCLEX and nursing and critical thinking is that they're going to give you one thing. They're going to give you the starting domino, and it's going to be up to you to kind of get the rest of the story and the rest of the facts and put the pieces of the puzzle together. So just like we kind of went through it from, caring from a kidney client, we know impaired kidney function clients can have weight gain and edema. And if we have a patient with crackles, then that's going to be consistent. So that's where we're going to go ahead and match those kind of clues. We're going to get Nancy Drew with it. Honestly, I always say that as a nurse, you're a detective. You're honestly everything, but especially a detective. So putting all those pieces of the puzzles together to make sure that that patient is as safe as possible is literally the theme of the NCLEX. So like the theme of NCLEX is client safety. So everything that they're throwing at you is going to be them assessing your competency of if you can see and assess a situation, whether or not it's normal or right. They're trying to see if you're able to assess that situation and act appropriately. Okay. All right, next question. Adult health for 500. Oh, wait, let me put accepting answers now. All right. So an alkaline ash diet is prescribed for a client with renal calculi. Which diet menu does the nurse advise the client to select? Is it 1, chicken, rice, and cranberries? I'm so hungry. 2, a spinach salad, milk, and a banana. 3, a peanut butter sandwich, milk, and prunes. Ew. 4, pasta with shrimp, tossed salad, and a plum. Whew, let's see which one of these. It is what is 2, a spinach salad, milk, and a banana. All right. It says in an alkaline ash diet, all fruits are allowed except cranberries, prunes, and plums. I was wondering why. I was like, is it like a raisin day? Like, is it purple? Is it alkaline ash diet like no purple fruit? But anyway, all fruits are allowed except cranberries, prunes, and plums. So the fruit options in 1, 3, and 4, so cranberries, prunes, and a plum, were eliminated in an acid ash diet. Okay, gotcha. So this is an alkaline ash diet, so all fruits except the cranberries, prunes, and plums. Did y'all know that? Because I did not. We learned something today. So who got what is 2? Alexis, good job, Alexis. Alexis got what is 2. So Alexis just got 500 points added. So Alexis just made it into the 1,000 club with 1,000 points. All right, so let's go ahead and see where we're at, because let's go to our board and see how many questions we got. 1, 2, 3, 4, 5. Okay, so we have 5 questions. Oh, it's 1, 2, 3, 4, 500. Poetic, cute. All right, so we have Lauren Johnson with 2,900. Then we have Alexis, once again, came out of nowhere with 1,000 points. And then we have, wait for it, Jarita with 700. Christelle with 5. Iris and Shayla with 3. Deja and Sade with 2, and an A in quad with 100. There we go. I did it. All right. So awesome jobs. Okay. So let's go ahead and we're going to do it from 100 to 500. Okay. So this is crunch time, guys. Let's go ahead and go with our first question and go. Accepting answers now. All right. The nurse prepares to administer a prescribed dose of scopolamine. The nurse should monitor for which side effect of this medication. Is it 1, dry mouth, 2, diaphoresis, 3, excessive urination, or 4, pupillary constriction? This is such a good one. All right, let's see what that is. And it is what is 1. Let's see who got that. Lauren Johnson got what is 1. So Lauren, you got an extra 100 points. That just brought you to 3,000. Awesome job. All right, so great job to everybody else that got what is 1. All right, so let's go and break down why it was 1. So scopolamine, that is an anticholinergic medication. So remember when I was telling you guys that it's like impossible to remember all the names of the drugs and all the different, drugs, but the best way to remember and to study for pharmacology is to remember the classes. Anticholinergic medications needs to be one of those classes that you put a star on. You will always get something on this. It'll be a different medication, I promise. Because it'll always be like, well, not always, but you'll always get an anticholinergic medication question, but it'll be, sometimes it'll be a different medication. Sometimes it'll be a different particular side effect of anticholinergics. But the most important thing you need to know about anticholinergics is those side effects. All right. It causes frequent side effects and notable side effects that include dry mouth, urinary retention, decreased sweating, and dilation of the pupils. In other words, there's a, hold on, can't see, can't spit. Wait, can't see, can't spit, can't pee, can't shit. I think that's what it was. Excuse my language. S word, whatever. So can't pee, urinary retention, can't spit, dry mouth, can't pee, urinary retention, can't see, dilation of the pupils, can't pee. I said, thank you, can't poo. Thank you, can't poo, or yeah, that's the constipation. Thank you. And the other one is the, hold on, I have to write it down because I just can't. It's pee, see, spit, and then we'll say poop, but it's supposed to rhyme with spit. Thank you, Christelle. C, P, spit, poop. All right. The P is for, I'm concentrating so hard. I had to write it down because it was not working for me. All right. So P is urinary retention. C is the dilation of the pupils. Spit is the dry mouth. And then the can't poop is the constipation. That was almost harder than my entire NCLEX, just trying to figure out what the 4 words was. Jesus. C, P, spit, poop. Whew. All right. So remember that much better than I remembered it, please. And those are the 4 main side effects that they're always going to somehow test you on. One of those 4 things, if it's attributed to like an anticholinergic, they're going to ask you about them dry mouths. They're going to ask you about the constipation, and then the nursing interventions around it. So make sure you know what those things are and how to relieve all of those things. Like dry mouth, suck on hard candy. Really, that's the only one I know for that one. But yes, it says the other options describe the opposite effects of cholinergic blocking agents and therefore are incorrect. Woo, that was an interesting one. All right, so yeah, that was Lauren. All right, next one. And accepting answers now. I feel like I'm about to have an aneurysm after concentrating that hard on a damn question. All right, let me move my head. Sorry. All right, skin breakdown occurs on a client's hand at the site of an intravenous catheter, that sucks, that had medication infusing. The nurse determines that which adverse effect occurred. Refer to this figure of a hand, with a hole in it, and it doesn't look good. Is it 1, phlebitis, 2, infiltration, 3, thrombosis, or 4, extravasation? I know. It does look deep and nasty. It is what is 4, extravasation. Let's see who got what is 4 first. Jarita said, I got to get back on the scoreboard. All right, Jarita, you have 200 points added to your score, bringing you to 900. All right, it says extravasation refers to the tissue injury that occurs from the leakage of medication into surrounding skin and tissue. It can also cause tissue necrosis. What is an example of a medication that causes, I don't even know if that's even fair to even say, potassium, IV potassium is something that, if that leaks into the tissue, You will. All right, so phlebitis is inflammation of the vein, and that can occur from mechanical or chemical, which is medication, trauma, or from a local infection. It says phlebitis can cause the development of a clot, which is thrombophlebitis. And infiltration is the seepage of the intravenous fluid out of the vein and into the surrounding interstitial spaces. I'm sorry, so it's infiltration for potassium. It's gonna burn either way. If it gets to your tissues, it's gonna burn. But I'm not sure if potassium being like infiltrated will actually cause like external tissue damage, like it is on the picture. I'm not sure if that's an example, but I know for sure infiltration happens with not vitamin K, potassium, and it burns. It said it is a form of tissue injury, but the injury is not to the extent that occurs with extravasation. So yeah, I was right. Chemomeds, yes, and chemomeds. They're like when you take IV therapy, or I'm not sure if they talked about it with you guys, but when you guys talked about IV therapy, did they specify like these are for sure the chemicals and examples that will cause that if infiltrated will cause a problem? They did for us, and that's why I was like, I know for sure it is the chemomeds and the potassium. So if you don't know, just note a couple, just in case you see it on the question on the NCLEX, you'll kind of have an idea. All right, conversions. Oh, this one's not a real conversion. You guys got it easy. Phenatone. Really? Phenatone's one? I gotta look it up. All right, next question. Vesicants. They just gave us the just know some examples of vesicants. That's the word that I could knock out. All right. The nurse reviews the arterial blood gas results of a client and notes the results indicate a pH of 7.30, a carbon dioxide level of 52, and a bicarb level of 22. Which interpretation should the nurse correctly make about these results? What is 3? What is 3? Let's see who got what is 3 first. Lauren Johnson. There's a lot of people between 3 and 4. So we're going to go with this. So Lauren Johnson got this one. Awesome job, hun. 300 points for you. All right, quick little overview. We have Lauren Johnson with 3,300. Then we have Alexis with 1,000. Then Jarita with 900. Christelle with 500. Shayla and Iris with 300. Deja and Sade with 200. And Quay and A with 100. All right, so let's go ahead and move ahead. Let me move my noggin. Okay, so it says, first of all, let's go ahead and break it down. We know that we're looking for our ABGs, so we know we need our pH, our CO2, and our HCO3. So normal pH is 7.35 to 7.45. In this particular problem, our pH was 7.30. So where are you? Okay, yeah. So normal pH is 7.35 to 7.45. So a pH of 7.3 is on the lower scale of the pH. And we know low pH is what? Either alkaline or acidic. Type it. type it. If something is low on the pH scale, is it basic or acidic? And then it says, in a respiratory condition, an opposite effect will be seen between the pH and the CO2. In this situation, the pH is low and the PCO2 is increased. So when we know that the specific parameter for like PCO2, I almost said PCOS, the carbon dioxide, that's a parameter for your respiratory. Okay, and we know that if the respiratory parameters are off, then we know that it's most likely a respiratory issue. So once again, we have our pH, which is going to determine whether or not it's alkalotic or acidosis. And right now it's 7.3. Normal is 7.35 to 7.45, which means 7.3 falls lower on the scale of the pH scale. And we know that the lower you go on a pH scale, the more acidic it is. A lot of people think it's basic because they kind of think, okay, as the lower you go, the more basic you get, but it's actually the opposite. The higher you go, the more basic you get. Okay, so kind of the opposite for that one. And then it says in this acidotic condition, the pH is decreased. Therefore, with that decreased pH, and we know that's an acidic pH, so we know it's something acidosis. And then we're going to look at the parameters as far as PCO2 and HCO3. PCO2 is going to be our respiratory, our lungs. That's going to be our parameters for our respiratory and the lungs. The HCO3 is our metabolic parameters. That's like our kidneys and everything else. So if our CO2 is off, we know that's an issue with the respiratory mechanism. If our HCO3 is off, then we know it's a metabolic issue. Okay, and so you have to take that as your first word, so metabolic, respiratory, whatever, and then you combine that with the state of the pH. Is it alkalytic or is it acidic? And in this case, it's acidic. So what we have was an abnormal CO2 because the CO2 was 52 and normal is 35 to 45. 35 to 45. So a CO2 of 52 is way off. All right. So we know that that CO2 or that respiratory parameter is abnormal. So we have respiratory acidosis. Does that make sense? Did that make? I tried to make it as much make as much sense as possible. If you need more help with ABGs, I do have an ABG worksheet. Where is it? There we go. Well, this is one of them. But yeah, it'll actually show you the scale. Oh, here it is. This is an actual like template worksheet that I use to try to help me because I struggle with the ABGs too. To try to help me with ABGs, it's like tic-tac-toe method. So if you like put in the parameters, and right here you'll have your correct parameters, so you'll be able to see the pH, the PaCO2, and it has what parameter it is. PaCO2 is respiratory, HCO3 is metabolic. So it has that all that here. You can get this in the Ultimate Nursing School Bundle, in the NCLEX Study Kit, or you can get it by itself. Yeah. All right. So who was that one? All right. So great job, guys. Now let's go on to our pediatrics. I had to make sure this wasn't the actual answer, and I'm going to move my head. I'm going to try to see if I can move my head. What is that word? Okay. The word that I'm hiding is nurse. I had to read through it again just to make sure I didn't put the answer in there. Oh no, I forgot to put it. All right, I'm gonna go ahead and start reading because by the time I finish, it's gonna be a while. So the client presents to the pediatrician's office with a temperature of 103 degrees Fahrenheit for the past 3 days. The nurse also observes conjunctivitis without discharge, cracked lips, enlarged reddened papilla on the tongue, inflamed oropharyngeal membranes, and enlarged non-tender lymph nodes. Using situation background assessment and recommendation, or SBAR communication, which statements and or questions should the nurse use in communication with a primary healthcare provider regarding this client's condition? Select all that apply. So one says, I am concerned this client has Kawasaki's disease. Can you please come assess this client? 2 says, this client is a 4-year-old male who presented to the client with a temperature of 103 degrees Fahrenheit for the past 3 days. 3 says, it is most likely Kawasaki disease because it is the leading cause of acquired cardiovascular disease in the U.S. 4 is, I think this client is at risk for aneurysm and thrombi development and should be taken to the hospital immediately. 5, I observed this client to have conjunctivitis without discharge, cracked lips, enlarged reddened papilla on the tongue, inflamed oropharyngeal membranes, and enlarged non-tender lymph nodes. So remember, this is select all that apply. 5 answer choices. It can be as little as 1 or as many as all 5. And let's look and see what that answer is. 1, 2, 4, and 5. 1, 2, 4, and 5. Who got 1, 2, 4, and 5? Christelle. Great job, Christelle. All right, Crystal, you got 400 points added to your score, bringing you to 900. All right, great job. Crystal got that. Alexis got that. Awesome. All right, so Kawasaki's disease is a disease that affects the cardiovascular system, leading to a fever, oropharyngeal inflammation, enlarged lymph nodes, fissured lips, conjunctivitis, rash, peeling of palms and soles, irritability, and aneurysms. The nurse should communicate to the provider the SBAR communication. All right, it says the nurse should say, this client is a 4-year-old male who presented in the clinic with a temperature of 103 degrees Fahrenheit for the past 3 days. I observed this client to have conjunctivitis without discharge, cracked lips, enlarged reddened papilla on the tongue, inflamed oropharyngeal membranes, and enlarged non-tender lymph nodes. I am concerned this client has Kawasaki's disease. Can you please come assist this client? I think this client is at risk for aneurysm and thrombi development and should be taken to the hospital immediately. So that is an appropriate SBAR. They informed the physician of the situation. Okay, so the symptoms, everything that's going on. The background, so what occurred or what's the history, I should say, the assessment, the actual assessment. So that's why whatever the nurse observed during that time. And R is for recommendation. What does the nurse recommend based on his or her findings? Okay, so all together, that SBAR, that paragraph right there is a perfect SBAR, okay? It says it should not say it is most likely Kawasaki disease because it is the leading cause of acquired cardiovascular disease in the US. Although the statement is true, it is not necessary and should not be included in the SBAR communication. This one is the one that's most diagnosing. Or most likely diagnosing. Yeah, this like the way you say things and the way you word things is very important. So especially when trying to not diagnose. So that's why you have to like we can't make medical diagnoses. We can make nursing diagnoses, but you have to know the difference. Like you can't say, "Oh, it's most likely this," because that's a diagnosis. You're assuming that this patient has this diagnosis, as opposed to saying, "I think this client has Kawasaki's disease based on these findings. So you're not saying, hey, this is definitively this, but it's saying this is a differential diagnosis based on my findings. I'm not the practitioner that can actually say for sure what this is, but I'm going to give you my findings, said healthcare provider, and you come assess the client and then piggyback off of what I assessed and said, and then make that diagnosis. And then they're going to go based off of, you saying that I think it's Kawasaki's disease, even if you, like a lot of people won't specify like, oh, I think it's that, just because of the, like it's too close to sounding like it's an actual diagnosis. But in that particular case, like I said, you saying, I think it's this, or I have a hunch that it could possibly be this, is different than you saying it's most likely this. Oh, he probably has a UTI. It's different than that. I think this patient has a UTI because of increased urination, So that way the doctor can, or the physician can then piggyback of your assessment and not have to start all the way over. So that's another reason why nursing is such a huge and integral part of the whole interdisciplinary care team, because we all piggyback off each other. And so we don't have to start the whole assessment all over again. Even though they're going to do their own assessment, they're going to piggyback off of our, hunch in our assessment, so they can make a more focused assessment to try to figure out what exactly that diagnosis is. All right. That's why I chose to clarify that, because I know for me, like the word, like especially when we do mental health, like I'm really going to explain that, because wording, especially on NCLEX versus like on your nursing exams versus like how it actually is in the actual textbook, with repetition, it gets easier, but it's definitely a learned curve. All right. We're on our last question. Okay, so let's do our scores really quick. So remember, top 3 scores are going to get the prize. All right, our surprise prize. And right now, this is our scoreboard, okay? So we have one more question worth 500 points. It can be anybody's game. So far, we have Lauren in the lead with 3,300. I think it's safe to say that Lauren got first place. Lauren, you could sit this one out. You got it. So Lauren got 3,300. Alexis with 1,000. And Christelle with 900. Those are the top 3 so far. No, I lied. Lauren with 3,300. Alexis with 1,000, and Christelle and Jarita tied with 900. Ooh. And then Shayla Iris tied for 3. Deja Sade tied for 200, and A and Quad with 100. All right, guys. Let's see who is going to take the cape. All right. Accepting answers now. Y'all working. Y'all are working. All right, so we have Jarita answered 375. All right. Where we at, y'all? Where we at? Where we at with the answers? Okay, so we are on our last question. Okay, there we go. There we go. There we go. All right, so the nurse is checking the remaining volume in a 1,000 milliliter IV bag that is scheduled to infuse over 8 hours on an electronic infusion pump. The nurse has just noted at 11 a.m. that the remaining IV fluid is at the 500 milliliter level. At 12 noon, at which numerical level in milliliters should the IV fluid be? Fill in the blank. All right. So once again, the nurse is checking the remaining volume in a 1,000 milliliter IV bag, scheduled to infuse over 8 hours on an electronic infusion pump. The nurse just noted at 11 a.m. that the remaining IV fluid is at the 500 milliliter level. 12 noon, at which numerical level in milliliters should the IV fluid be? Fill in that blank. All right, let's go ahead and see. I'm seeing my answers here. All right. The answer is, what is 375? 375 milliliters. And who got that first? Jarita. All right, Jarita. Jarita, you just got 500 points added to your score, which brings you, I almost did not do that math right. That would have been so embarrassing. 1,400 points for you. All right, so it says, if the IV is scheduled to run over 8 hours, okay, then the hourly rate is 125 milliliters per hour. Okay, because remember, we have 1,000 milliliters starting and it's scheduled to infuse over 8 hours. So in order to get that hourly rate, to see how much is infusing per hour, we would divide that 1,000 by that 8 to get 125 milliliters per hour. So using 500 milliliters as the reference point, because remember, that's where they noted it at 11 a.m. The next hour should be, you should add on another 125 because it's only an hour from 11 a.m. and 12 noon. And they're asking for what level the fluid should be at 12 noon. So if you know that it infuses at 125 milliliters per hour and it's at 500 milliliters at 11 o'clock and it's only 1 hour until the next time that you have to check it, what level should it be in 1 hour? So you would take that 500, which is at 11, and you would add it to the 125. Okay, because in 1 hour, it's going to be noon. So in 1 hour, it should be 125 milliliters should have infused to what has already infused. All right, and so that should leave you with that 375. Does that make sense? Okay. I think I said that backwards. 500 minus that 125 equals 365. I think I said added, but yes, 125 less than the 500. So that just ended our NCLEX Jeopardy, and our winner. I know y'all missed it here on Instagram Live, but that's fine. So we just finished NCLEX Jeopardy, and our grand prize winners. We have 3 winners for our highest scores. First prize winner is, drumroll please, we already know it's Lauren Johnson. Go Lauren, yay, go Lauren, go Lauren. She had 3,300 points. Just came and was just stealing all the points. Okay, so 3,300 points for Lauren. Congratulations, Lauren. Please message me your email. You are going to receive either the Ultimate Nursing School Bundle for free if you don't have it already, or you get a free nursing t-shirt from my website. All right, any shirt you would like. So if you do not have the Ultimate NCLEX bundle, you won that one. But if you do have it, then you won a shirt. Okay. All right. So Lauren Johnson, let me know which yours would, which your prize would be, what you would like your prize to be, either the bundle or a shirt. So Lauren with 3,300 in first place. And then for second place, we have Jarita with 1,400 points. All right, Jarita. All right, so Jarita, same thing. Same thing for you, Jarita. If you would like that Ultimate Nursing School bundle, over 475 pages of nursing school material, creative nursing school material, and also it also includes an extra hour or a replay of one of the previous NCLEX Jeopardy sessions that we had, just like this. So if you would like that, let me know. If not, you get a shirt. So first place, once again, we had Lauren. Second place, we had Jarita. Third place is Alexis. Alexis with 1,000. All right, Alexis. So same thing with you, Alexis. You have won either the Ultimate Nursing School bundle or an awesome shirt. Okay, so I have your email, so I will be emailing you. And let me know what you would like as your prize. Thank you guys so much for joining me for NCLEX Jeopardy. This was so fun. Let me know how you guys enjoyed it. It is something that you guys would want me to continue. I've been doing it for about a year or so. And every time I do it, it helps even more people. Okay, so you guys definitely loved it. I'm so glad you guys enjoyed this review. So we are doing this main big one where we have the blue screen. I'm thinking about doing this one. Well, I'm going to do this one monthly. We're going to do the ones on Instagram weekly every Thursday. But you know, the last Thursday of every month, we're going to be in our webinar room playing our NCLEX Jeopardy for our prizes. So once again, the winners for June's NCLEX Jeopardy were Lauren Johnson, Jarita, and Alexis. Great job again, everyone. Thank you so much to everyone that played and participated. Even if you did not win top 3, just remember that the actual point of NCLEX Jeopardy is for you to practice and review for the NCLEX. So even though you were not getting the first answer and not getting the fastest answer, remember that's not what really counts on the real thing. It counts on NCLEX Jeopardy because we're just playing for fun, but on the actual NCLEX, speed doesn't, well, speed doesn't matter. They're not going by who finishes first or who, you know, gets to 75 questions first. Get through it, take your time, pass the NCLEX. That's the whole point. So as long as you were getting the answers correct, you won. Okay, so thank you guys so much for joining me. If you did not catch it on my Instagram Live, if you did not catch it, I'm so sorry. We had so much fun. I will be posting the replay. Make sure you signed up for my emails and my text so you can get the alert for when that is available. Everyone that registered, you guys are going to get the replay by tomorrow. And for you guys that did not register, y'all not going to get it tomorrow. But you'll probably get it sometime next week. But that goes to show you that you need to come to NCLEX Jeopardy when it's happening, okay? All right, so thank you guys so much. And I will see y'all next time on Instagram for NCLEX Jeopardy, 7 p.m. next Thursday. Thank you guys.